So this is clinical research training at Wake Tech. I'm Steve Pope. We're talking about ethics of trial design. So what we're going to be doing is taking a look at a series of articles in our textbook, Ethical and Regulatory Aspects of Clinical Research. You'll see the articles listed there along with the page numbers. And what we're going to be talking about specifically are going to be placebo-controlled trials. So a couple of these articles are going to be written by authors that are in favor of placebo-controlled trials. Some are not necessarily in favor of placebo-controlled trials, and we're going to talk about some of the ethical issues related to that. We're also going to talk about the use of women and minorities in clinical trials, some of the pros and cons associated with that. And although many of those discussions have occurred in the past, it is interesting to go back and take a look at them. And so we have something to go by in our contemporary news. So I think that these articles that you're going to be reading and discussing this week are going to be interesting for you. I think you'll get a lot out of them. I don't think anybody's going to have any difficulty discussing the concepts once we get to the discussion forum. But at any rate, if you do have questions, certainly I'll either put them out there on the discussion forum or put them in the questions to the instructor so that everyone can see them. So our learning objectives for the week, we're going to be discussing the ethical issues associated with using placebos in clinical trials. As you know, placebos just refer to no treatment, so it's going to be a dummy. The patient's not receiving the research article, the research drug, so they're basically not getting any treatment at all, and we're using that as a comparator against the trial treatment. We're also going to look at understanding the ethics of including women and minorities as research subjects in clinical trials, why it's important to do that, and why we need that data from those subjects in order to make our trial results as highly generalizable as possible. So anyway, we will be talking about that as the week goes on. As we start to look at the ethics of trial design, it's important to understand that for many people, the use of placebo in clinical trials is considered the gold standard for proving efficacy and safety results for a new drug. Essentially, you want to be, they argue that using those is the best way to determine how effective a new drug is and how safe it is within the clinical trial data. Also, we're going to look at the use of placebo when a safe and effective treatment already exists. There are some ethical issues related to that. Some think that it's not so ethical to do that. Others argue in favor of using placebo even when effective treatment already exists. In any clinical trial, there are going to be risks, and the trial designers are going to assess the risk-benefit before they start the trial. So every trial is going to have a balance between the risk to the patient and then the benefit to the society at large, or to that potential population of patients that could benefit from that treatment. And we'll talk about that a little bit. We're also going to be talking about the inclusion of women and minorities in clinical trials as study subjects and how important that is. And finally, for your discussion board question, what I want you to do is read through the articles and then think about the use of placebos in clinical trials. Are they ethical? Should they be allowed? Are there circumstances where they should not be allowed? Or are there circumstances where they should be allowed? So think about your past experience. Think about your own personal feelings about that. I would like for you to cite examples from the readings. Now, you don't necessarily have to cite the articles in your posting. You can simply refer to the article by the last name of the author or authors if there's more than one. But at any rate, I think this will be a good question to think about, to ponder, These are issues that never go away. 50 years from now, we're still going to be talking about the ethics of using placebos in these trials. So it's never going to go away. So at any rate, have fun with it, and I'm looking forward to your responses on the discussion board.